All right, so we just finished up an eval and first visit with a patient who's got patellofemoral issues and a history of subluxations. So tell me what it was like when I would test you strength-wise before I would treat you and after I would treat you.
Yeah, the first time I was pretty weak and I had to think about it and put a lot of strength in. And the second time it was kind of weird because I didn't have to think about it as much and my body kind of just did it without me thinking about it.
Okay, so it felt like you were stronger when we got done.
Yes.
And then before your visit, did I have you do like a battery of tests like squats and single leg squats, that kind of stuff?
Yeah, at the beginning of the visit.
Okay. And then what did it feel like when I had you do those at the end? Because we redid everything, right?
Yeah, it was better. I felt like I had a little bit more balance. It's still hard to balance, but it was more than the first time when I wasn't as weak.
Okay. And when you came in, I think your mom mentioned something about you being an overpronator, having pronation control problems. What does that mean? Like, did you have pronation control problems or do you have a different problem?
It was under subluxation. What's the word?
Under supination?
Supination. It was an S.
So she's not an overpronator. She's an under supinator because the muscles that are supposed to be controlling pronation, eccentrically, were not doing anything for her. So initial single leg squat, unstable, weak. Okay. Initial toe touch, tighten the hamstrings. Initial double leg squat, really hard to get down.
Yeah.
But then when we got done,
it was better.
Okay. All right. And that's just after one visit.
Yeah.
Okay. So after one visit, you could do more at the end than you could do before. Did what I was doing make sense?
Yeah. Well, I'm not a doctor, so it didn't really make a lot of sense. But when you explained it, it made sense.
Okay.
And then it seemed to work.
Okay. So you tell me how I explained it to you.
You were pushing on different muscles to activate the nerve connection, and then the muscles would fire how they're supposed to.
She wants to go into poli-sci. She should be like a biomechanics major.
That was hard for me to remember.
Yeah. Okay. Okay. I'm trying to think of what else. Any other cool things that happened?
It pops less.
Okay.
So that's cool.
Okay. So initial complaint is patellar popping, feeling like it's coming out, that kind of stuff, to the point where sometimes she feels like she has to like put it back in. So we talked about the patella. Yeah. So is the patella smart or is the patella dumb?
The patella's dumb.
Okay. Because?
Because the other muscles are supposed to be controlling it, but they weren't.
Yep. So the patella is stuck in between the
muscles in your leg.
The hip and the foot.
Okay.
Okay. So if the hip and the foot don't do what they're supposed to do, can the patella do anything?
No.
No. Okay. So is taping the patella or bracing the patella going to fix your problem?
No.
No. Is making your foot more stable with some kind of external support, like a rigid shoe or arch support, going to fix your problem?
No.
Okay. Are those things actually going to make your problem more likely worse?
Yeah.
Okay. All right. So what's going to fix your problem?
Fixing the muscles.
And what specifically with the muscle?
Like making them work how they're supposed to work.
Okay. So there's a high school senior breaking down neuromuscular physiology on the level of your patients. So she just educated me about neuromuscular physiology without really knowing what she's talking about, but understanding what we did, why we did it. So are we going to stretch anymore?
No.
Okay. Why aren't we going to do that?
Because I don't actually know why. Just because you're supposed to do the exercises instead of.
Will stretching make the nerves turn on?
No.
Okay. Will it make you stronger?
No.
Okay. All right. So if I can educate her in one visit and have her understand, and the most important thing is, so if I would have just told you all that stuff and I didn't actually treat you, would you be like, yeah, whatever?
Yeah, probably.
Okay. So the first time I turned the muscle on, so the first one that I did, what did you say as soon as I did that?
That's so weird.
Okay. That's so weird. How did you do that? So if she can feel the immediate change in facilitation, which she's calling strength, and she feels the difference in her pre-screen versus her post-screen, and now she has the educational component in the middle of that treatment sandwich. Now she understands what's going on. And are you going to do your exercises because they make sense?
Yeah.
Okay. And they work?
And it feels better.
Okay. So there you go. That's why you should be using neuromuscular physiology to your advantage with your treatment and your assessment and your patient education and your exercises. So your patients sound like this rather than sound like, well, I felt better for a half an hour after PT, but then everything came back. So then I went and saw the chiropractor.